Good morning. This is Erin with the Department of Medicaid. It's not quite 9 o'clock and we're still clearing out the waiting room, so we'll give it just a few moments before we get started.
Right. Thanks, Aaron.
It is 9 o'clock, excuse me, and the waiting room is cleared. Steve, I saw you, Brandon, Adrian, Van, Casey, Kristen, and Kevin. Did I miss anyone else?
Don't think so. And that's a quorum, correct?
Two, three.
7 of 12.
Yes, sorry. I had to count for a moment.
All right, very good. All right, folks, welcome to the May meeting of now we're just going to go with the reentry TAC. And we did our kind of roll call and introductions, and we have a quorum. So I sent out the minutes. Is there a motion on the minutes from the March meeting?
Motion approved.
And a second?
Second.
Second. And all in favor?
Aye.
Aye.
Thank you. Very good.
Van and Kevin, I need your cameras on when you vote. I'm sorry.
And I do not have, this is Kristen. I don't have my camera on either. I am driving to my office. I'll be there in 10 minutes to put my camera on.
Okay. Steve, do you mind if we revisit so all of our voting members are on camera during voting so we're in compliance?
Yes, that would be fine.
Thank you. Appreciate you. Sorry about that, guys.
Thanks, everyone. I apologize. I had 2 meetings back to back this morning.
No worries.
Yeah. And Aaron, the website, the link isn't the new link.
It's being pushed through publishing.
Okay.
And I'm not sure what happened there because I know Kelly updated it. I walked her through how to do it when she got her editing purposes. So Beth, our communication liaison is on it.
To report it, they can't get on because of that. So anyway, just so you know.
I'm happy to forward it if needed, the invite.
Yeah, I think we could get lost in that process, but it was Marcy Timmerman. I don't know if you have her email built in. I don't have it handy, but I suspect there's other folks.
Steve, I'll send it to her.
Okay, thanks, Adrian.
Sure.
I think there's probably other folks have the same problem, perhaps, but I'll deal with that right now. And if I get any other messages, I'll let you all know. So let's do our DMS update.
Hi, Steve.
Okay,
it's Angela Sparrow. Good morning. I think we again had talked about presenting some information following our ACRES kickoff in terms of the 11-15 reentry. So again, we're prepared to do that this morning. If we want to jump into that discussion. but I'll pause. I'm not sure if Leslie was able to make it on yet.
This is Leslie. Angela, I didn't have any specific updates other than I wanted to listen to your presentation today.
Okay. All right. Let's go ahead and do that. Let's see, Erin, I'm gonna.
You should already be a co-host, Angela.
Okay, thank you. Okay. Let's. All right, can everybody see the slides?
Yes.
Okay. All right. So again, we just kind of wanted to recap and share some information, and we'll go through this. Some of you all, again, are familiar with this, I hope, and then some of you, again, just kind of want to give you an up-to-date in terms of the reentry application, where we are, what the plans are, and kind of the how we intend to design and implement moving forward. So again, just wanted to recap for anybody who's not maybe familiar with, we continue to talk about section 1115 demonstration. And so what does an 1115 demonstration mean? And again, it's really what it states it is. And so it is an opportunity for states, as we've talked about, for Medicaid agencies to demonstrate or pilot projects, services, ways to deliver services, flexibilities in benefit packages, and so forth. Again, to improve the outcomes of our individuals in the Medicaid program. And so again, once approved, it allows the states to really operate outside of, our typical rules and regulations. And again, it is to demonstrate and pilot things that are not, that cannot be approved in our state plan. And so with that being said, it's extensive monitoring and again, reporting to CMS to allow for these flexibilities. And again, the states are really held to, terms and conditions of the approval that we need to ensure that we're meeting. As well as, again, we have to really kind of take a look at our spending and our expenditures, right? And so again, there's the budget neutrality piece and component that we continue to speak to, but we also have to demonstrate that the state is not spending more through the demonstration than we would otherwise. And so that, I know that sounds tricky, but there's ways, again, to go about that. And so that's, again, part of the approval process. So when we continue to talk about, and you hear 1115s, that's, again, an opportunity. And so there are specific demonstrations. CMS has given states the opportunities. And then again, states can request things outside of those that are, specific to their state. And so with that being said, again, it's typically, the approval negotiation process can be extensive for that in meeting those terms. So not, again, CMS is not going to approve and say okay to everything. And so everything just can't be done under an 1115. It's just not that simple. But we are, again, thankful to have the opportunity for states to use these demonstrations. And so in terms of the reentry demonstration, again, I think we've most of us have spoke to really the needs of the population, of this population, and for those individuals that are just as involved returning back into our communities. And then again, the barriers that they face when they are returning back into the community. So with that being said, I think, again, we're all aware that, Kentucky was the first state to request a demonstration of this sort around incarceration services. And so we were waiting for CMS guidance, which we know was issued last year. And so within that time period, we were reviewing CMS's guidance to states regarding this opportunity, and we knew that we were going to need to make some changes to our pending application based on what they were going to allow states to do. And they, again, were really focusing on that pre-transition, pre-release time period, and really focusing on ensuring that those needs are met for that individual, that there's that seamless transition back into the community, that those needs are identified, that that plan is in place to support that individual to be successful upon release. And so that's really the focus that the CMS through the reentry demonstration opportunity is looking at. Again, they made it very clear to states, the intent is not to supplant any of the funding that the justice or our carceral facilities were already providing services for, but really, again, to partner with our justice facilities to ensure that we come together to meet those needs when in that warm handoff into the community. And so, again, just through the state Medicaid director's letter and the guidance from CMS, again, there are goals, specific goals that the state is required to meet under the demonstration. And so I just wanted to point these out and ensure that you all are aware of those, but really, again, that improving the access to those services by increasing the coverage pre-release, being allowing for that continuing of coverage into the community, whereas beforehand, again, it was not until that individual actually leaves that facility that they're eligible for services. And so, again, recognizing the importance of that. And again, we spoke to improving that coordination, communication, our connections between our Medicaid systems, our correctional systems, our community providers. So really ensuring that we have that those linkages and collaboration to support this. And again, looking at reducing the number of avoidable emergency visits, inpatient hospitalizations. Again, we know that as we spoke to this, our justice involved individuals are at higher risk, really returning back into the community. So really trying to reduce those risks. And then again, increasing the opportunity to increase investments into the healthcare system, but really, again, trying to address those health-related social needs and what those needs are returning back into the community. So these, again, are the goals of the demonstration. And so along with the goals, there are specific milestones that the state needs to ensure that we're meeting to obtain approval and continue to obtain approval. So these milestones are really, again, kind of the roadmap in order to meet those goals. So I just wanted to ensure that you all are aware and familiar with those. Again, this is how we would continue to track and monitor, and this is really going to drive our implementation plan. So within the demonstration, I think we spoke to many of these things before, but just wanted to ensure part of the approval. Again, the states do have to meet a minimal benefit package, and that does include the case management services. So through case management, we really need to identify the physical and behavioral health and or behavioral health needs, as well as the health-related social needs. So again, the housing, employment, food, transportation, those needs also need to be identified through the comprehensive case management service, and this is pre-release to continue post-release. Again, states are required to offer medication-assisted treatment for substance use disorders. So again, this would be all forms of FDA-approved medications to treat substance use, as well as the therapies and counseling with that medication. And so that is a required package, or excuse me, a benefit. And then also, again, the 30-day supply of all prescription drugs at the time of release. Those are the minimal benefit packages. Again, states can request additional services, and we'll talk about that in the you know, some of the impacts and complexities of approval and implementation for the more benefits, you know, requested initially. And so states again are also required to develop a readiness assessment. So any of our facilities, correctional facilities that would be eligible to provide these services under the demonstration, they have to go through a readiness assessment to ensure that they're able to provide access to all of these services. So again, you know, if Medicaid is developing a benefit package and plan, we want to ensure that the individuals who are eligible for that have access to it, correct? So again, we have to demonstrate to CMS that in all of the correctional facilities that would be eligible, that we can ensure that they have access. And then again, we are also required to develop a reinvestment plan. So any of the state, the federal dollars, again, that the correctional facilities may already be providing services in, let's say, for instance, some of our state prisons are already providing access to medication-assisted treatment. For those existing funds, the state again would need to reinvest our federal match in that. But again, if it is not available across all of our state prisons, or if there are not specific medications that are available in certain state prisons, again, that could be included as an expansion or a new service. And so those dollars would not require reinvestment. So this is a new piece under the demonstration that states again have to meet. And then of course the implementation planning is required. So we are required to submit that. It has to be approved by CMS, and really again, that's our roadmap to demonstrate to them how we are going to meet these milestones and goals and stay within the terms and conditions that is issued to Kentucky. And so, again, we through last fall, as you're aware, hopefully, reviewed the guidance, had some conversations with CMS about the guidance, about our pending application, and then began to hold some stakeholder engagement to identify, again, the needs in various areas, existing infrastructure, and so forth, needed to, again, amend our application. So we did have several small group interviews, some focus groups, again, with our state partners, with advocacy groups, with, again, our TACs and so forth. And then, again, our managed care organizations as well. And so we did draft our application, went through the public comment period that was required, and then we were able to submit that to CMS in December. And so again, the demonstration submission did align with the state Medicaid director's letter and really the guidance with the focus on improving the care transitions for our justice involved individuals that are soon to be former inmates of a public institution and again, otherwise eligible for Medicaid. We also again included our requests for the recovery housing supports. So hopefully again, you'll begin to hear about RRSS, which is Recovery Resident Support Services. And that again is a service that is being developed and it will be implemented. So for our recovery residents that meet criteria to deliver that service, again, it is really addressing the support services that those recovery residents are providing to individuals that are residing there to support their treatment, their recovery, long-term recovery, and again, being able to live independently back into the community in their long-term recovery. And so again, this is going to be limited to certain populations that we'll talk to next. And so really just kind of a reminder, there are many factors that the department and our state partners considered when drafting this application. And so again, we we had heard from CMS in those conversations, right? They were really encouraging states, take a good look at that letter, stay within the guardrails. If you want to request, above and beyond, you can. But we had heard that there was, again, in terms of approval for these demonstrations and the volume of applications, it would really impact the timeline of when states might seek approval. So we did consider those things, as well as the stakeholder engagement activities and our findings from that. Again, in our conversation, CMS did make us aware that our initial application did include some specific slots, if you will, kind of limited the number of eligible members that could be served in a time period. And again, that was not something that we were going to be able to do under the new guidance. And so we could narrow and target our population, but we would not be able to limit to a specific number of individuals that could be served. And then again, really kind of looked at our current landscape in terms of also kind of a timely approval regarding our benefit package that we wanted to request. And so again, knowing that it would impact budget, right? The more services requested is going to impact budget. Initially, our reinvestment, the facilities. So the more facilities we're also including, they have to have access to these services. And so again, it was very complex. So again, really kind of choosing the minimal benefit package to start with, hoping that we again obtain that more timely approval, we can get going, and then build from there. And so we also included, again, our justification. States were informed that if we're going to request more than 30 days pre-release coverage, we really needed to provide justification. We could go up to 90 days, but again, would not be more than 90 would not be approved. So really, again, we understand that the engaging with that individual, building that rapport, identifying the needs, the communication, collaboration, again, really, if we're able to identify someone's release prior to 30 days, we need prior to 30 days to ensure that that's, successfully, those needs are successfully identified, returning to the community. So we were able to submit, justification for more than 30 days within the application. And so this is just, again, a reminder, hopefully an overview in terms of what was requested, our populations and the benefit package to CMS. And so we did include adults and juveniles, our youth. So again, we will continue to suspend rather than terminate eligibility at the time of incarceration, or again, when a youth may be detained. And so the demonstration really encourages states to, at the time of suspension, ensure that all individuals apply for Medicaid. So again, even if they are not currently a Medicaid member, but go ahead again, screen for that eligibility, and then can suspend. Therefore, at the time frame pre-release, it can be reinstated, and again, those individuals that may not have been eligible can be eligible at that time frame. So benefit package, like we said, case management, the medication assisted treatment, a 30-day supply of all medications, and that's over-the-counter medications as well. They'll also, again, receive ensure that they receive the medical, our durable medical equipment, prescriptions for those, if that's set up again at the time of release. And then again, the recovery resident support services, that will be for our adults, our adult population. And so we initially included our state prisons for our adults, and for our youth, again, our youth development centers, our YDCs. And so again, the package does not initially include jails as a covered setting, and we can speak to, but again, we have to keep all of those factors in mind that we discussed. We have to be able to ensure that they can suspend eligibility, reinstate that within the time frame, that they're able to have access to all of the services under the approved package. And so again, we know with the amount of jails across the state, and again, they do operate very differently across the state. It is going to be very challenging. So initially, we did move forward with the state prisons and our youth development centers with the plan of adding jails at a later time. And again, kind of still including them, thinking about them through the implementation process, but again, amending the application when we feel we can bring them on board. And so again, the services in the benefit package, again, can be delivered in person and or via telehealth. And so we really want to think about access to the individuals for some of these 60 days prior to release is to be able to see them face to face is going to be challenging and difficult. So again, our correctional facilities will have flexibilities in delivering both in-person and telehealth services.
Angela, on the benefits side, I just want to make sure we all understand this. These are the services they could get 60-day pre-release, right? And once released, they get the full Medicaid benefit plan, correct?
Absolutely. Yes. Good point, Steve. So yes, through Medicaid, they would be eligible for these selected services 60 days prior to release. So it is a selected benefit package. Upon release into the community, post-release, it's full state. They go into their typical benefit eligibility.
Assigned to an MCO, physical health, behavioral health, dental vision, whatever.
Oh, yes. And so again, it is, you do have to think through, right? It is very complex in terms of being able to, how are we going to, identify and limit eligibility 60 days and then flip that switch. They're eligible for full state plan benefits at that time that they're released. In terms of delivery of services under the demonstration, and so for case management, again, our DOC and DJJ partners in programs, again, they do a great job in providing case management and will continue to do that pre-release. It is then again at 60 days, that 60-day mark again, or within that 60 days that they're identified as released, that our MCOs will engage with DOC and DJJ and that individual to be a part of that case management plan. So really, again, that's where we're going to be screening for those physical health, behavioral health, and health-related social needs, identifying what those are, establishing that plan, that person-centered plan, to ensure that they are that those needs are met upon post-release, pre-release, and post-release. And so again, in starting to build that rapport with that individual, so the MCOs will also provide, which I don't think is here and need to add, they will also provide the case management up to 12 months post-release. And so that will be under their state plan, benefit package, if you will. But that is, so it doesn't necessarily fall under the reentry demonstration, but that is something that will be included. So they, again, if eligible, if they agree and needed, they'll be eligible for case management through the MCO's 12 months post-release as well. For the MAT services, DOC and DJJ, again, they will provide those services while that individual is incarcerated. They do, again, will be able to contract with other community providers, other providers to provide that service if they choose to do that. But again, DOC, DJJ, they would actually be the enrolled provider with Medicaid for that and receiving reimbursement for that service. But again, they could contract if they choose to do that. And then the 30-day supply of medications, Diamond Pharmacy is actually already contracted with enrolled Medicaid provider. They do provide those pharmacy services for both DOC and DJJ. So they'll continue to do that through the demonstration as well. With the 30-day supply of medications, we also do know that there's some concern. So for instance, individuals that would be receiving MOUD medications for opioid use disorder, it may not be appropriate, clinically appropriate for those individuals to receive a 30-day supply of medication at the time of release. And so again, continuing to have some conversation with CMS about that, but they have given some states. There is language in the letter, and again, believed to be in the standard terms and conditions that the states are, within their current policies, and what they are permitted to do are to meet this 30-day supply. But there are going to be instances that if an individual is leaving the correctional facility, it may not be appropriate for some of those medications to have obviously a 30-day supply. And again, they may not be able, there's some prescribing limitations absolutely as well. So I just wanted, to make sure that is conversation that.
But those folks will still have access upon release for additional subscriptions or something going forward, right?
Yes. Yes. So for instance, maybe say only a 3 to 7 day supply is appropriate. They would leave that facility with the intent, right, is that they would leave the facility with, 3 to 7 days of that supply with the appointment for that follow-up provider in the community who's going to see them, be their continued prescriber, right? And so then with that being said, they would also need to ensure they have the transportation to get to that appointment. That's all part of that case management plan. So yes, that's what the state would need to ensure to CMS that we have that in place, and part of that plan to ensure that they are able to then their pharmacies already identified. Once they go to that prescriber, is followed up and seen to continue that medication, and so.
Angela, would a 30-day injectable of buprenorphine meet that requirement of 30 days?
Yes, if that is one of the medications that they are on, it will be a medication that would be included in the benefit package.
Thank you.
Okay, so just kind of an overview again of what we have done. We've talked about some of those things, right? We did the submission, the pre-submission, stakeholder engagement. We did complete our federal public comment period. So we've done the things that we have needed to do after submitting. And so we're really at this point in the what we would typically call the negotiation stage with CMS. And so I'll talk a little bit about that when we give some updates on where we are and why I say typically negotiation. But again, so they did initially reach out with some questions after reviewing the application. It was really just more clarifying questions. And so we have been hearing more, honestly, and even just the last couple of weeks from them. And so I'll talk to you about that. But while we were kind of in their review phase of the application and waiting to hear back from them, we continue to move forward. Again, in terms of what is our implementation planning going to look like. And so hopefully, again, you're aware that we are developing the advisory work group, and we're going to go over that frame of work. But then we will continue from, calendar year Q2 into Q3. We'll have some additional stakeholder engagement interviews. And so again, what was pre-submission to CMS was really kind of identifying what is our current landscape, what is the infrastructure. It was very high level, but once we get the approval and begin working on implementation plan, we really have to get into the weeds. And so that's what those, it will be different stakeholder engagement interviews. And again, that will be the focus. And so it will also be, again, facilitating what our work streams are going to look like again, and we'll go through that. So that's it. We can envision that as what our subgroups, if you will. But that again will be taking place over the next couple of quarters. And so we did kick off the Kentucky Acres, the Advisory and Community Collaboration for Reentry Services work group that was kicked off in April. Again, it was just really kind of an overview of much of what's being discussed today, kind of lay out the framework of what the expectations are for that work group, what we hope to achieve, what is the mission and values of that. And again, begin to kind of lay out the roadmap over the next several months, actually. And so we do want to ensure that we have representation. It's very important in order to ensure that this demonstration is successful, that we really want to have, an infrastructure and a great infrastructure already in place. And so we want to be able to build upon that so we can expand over time. And so again, we do value again the partnerships among our state agencies. Our community partners will be involved, especially again individuals of lived experience. We will need those viewpoints in collaboration as well. And then again, this is really going to be an effort across the state again. And so you can see here that there are many components of the waiver that the advisory work group is going to kind of oversee in terms of implementation planning and how we will deploy the waivers. So the advisory work group, again, just as we noted, our state partners, representation from DMS, from DBHDID, DCBS, Office of Drug Control Policy, Public Health. Again, certainly DOC and DJJ are going to be very important in this. We have representation from AOC, our MCOs, and again, as mentioned, community partners, advocacy organizations, and those with lived experience. And so here we can see that again, Acres, the role of Kentucky Acres is really going to provide that high-level executive oversight discussion, again, in terms of concerns, approvals, really ensuring that we meet the broad reentry goals and objectives. And so from the Kentucky Acres Advisory Committee, we'll also, again, develop the core project team. So I know you all have heard us speak, and hopefully within the next week, you'll hear from us. We, again, will also develop a core project team. So that will be representation from our Medicaid folks, areas and divisions within Medicaid that the waiver is really going to impact. DOC, DJJ, our MCO partners, and then again, our other state agencies will be involved as a partner in the core team. So they, again, will also be overseeing the implementation and the project needs. And so what are the policy development, overseeing policy development and execution of the policies, But again, they're going to provide that direct oversight to our project work streams. And so again, project work streams, we can envision that as, typical like sub work groups. And again, these will be comprised of subject matter experts of each of the work streams. And so the work streams, again, you can see we will be working through operations, right? And we'll get into the we'll show you kind of what the workflow is going to look like. So how are we going to implement the policies that need to be developed? So the policies and procedures to do that, right? That's going to be another work group. Physical management, our IT systems. So again, part of the demonstration is really integrating our IT systems and able to share data, our health records about these individuals, because again, it is going to take a collaborative effort to ensure that we're working together to meet the needs of these individuals returning back into the community. And so there again will be extensive monitoring metrics and reporting. There will need to be training and technical assistance for our partners that are involved in implementation. And so again, workforce development, capacity building, several things here that you can see. And so each of these work groups will pull in from our core project team. They'll identify who are the subject matter experts in their area to work on each of these work streams. In addition, we will pull in individuals from the ACRES Advisory Committee. And if there is any individuals, again, outside of these that need to be pulled into these work streams, we'll do that as well. But the project team and the work streams will be kicking off hopefully here in the end of May, and you all will hear from us in invites about that. So our advisory committee will meet every other month. Our core project team will meet monthly, and then our work streams will be meeting every other week.
And TAC members may participate on some
again,
of those. Yeah.
Yes,
Some of the TAC
so
members,
we can
yeah.
identify, Steve. Yeah, we can identify some of those individuals that might be appropriate in the different work streams. And so the work streams, again, are really going to develop the proposed free entry process. And I'm not going to go step by step. We'll send you these slides so you can look at this, but this is really kind of breaking down the steps from the time that the individual enters the correctional or justice system until they are released and post-release. And so our work streams will really, in the components of the demonstration, will be mapping out and planning how do we implement this proposed workflow in order to implement the demonstration. And so that's really kind of to bring it all together. This is the big picture. Our work streams, the core team, our advisory group is really going to be our governance structure to ensure that we meet the goals, the milestones, and able to implement this very complex and comprehensive demonstration. And so this again is just for our adults. Oh, go ahead, Steve.
Yeah, JAI is justice involved individuals, right?
Yeah, justice involved individuals. Yes.
It's a very
complicated
flow chart.
Yeah. And this is just
Congratulations,
the
whoever did that. They got some more talent than I do.
right. And again, hopefully if we'll may have them sit on some of the, welcome if they want to be a part of the TACs too. But again, Myers and Stauffer has been assisting us with project management and, oversight of this. And so you will hear from them in terms of invitations and invites and meetings. And so again, if you do if they reach out to you, they are assisting with the state in this project. And so, again, this is just the proposed workflow and process for our youth. And so again, our stakeholder, when we do say that there will be more stakeholder interviews, like I said, it will be different than those initial pre-submission. This is where we really start. Those initial stakeholder interviews helped us create this map and workflow. And then the stakeholder interviews that we will be having over the next quarter or so is to really get into the weeds of this in the current process and policies and procedures. So it will be different. It was more high level. We'll be actually really getting into the step-by-steps in those as well. And so those stakeholder interviews may also be in addition to the work stream subgroups as well. So all right, so where are we now? Again, we have been receiving some communication from CMS and discussion. In April of this year, they did announce that they are piloting again a strategy to expedite application reviews for pending states with reentry demonstration applications. And they're going to be utilizing a bundled cohort, if you will, approval approach. And so it will be it'll be like a quarterly approval for the pending states or those states that come on board. Selected states will be approved each quarter together in kind of a cohort. And they are implementing more standardized approaches to the approvals in order to expedite this process. Again, understanding the importance for the states to be able to obtain approval and continue through the steps to actually implement and ensure access to these much needed services. And so I think there were 15 or so states with pending applications. 4 have been approved so far. So again, you can see they've communicated to states that the bundles were based on just a combination of factors, applications, are they a part of pending applications, demonstration applications, and so forth. So Kentucky is included in the first bundle, which is great news, and it's with expected approval by July 1st. So in this quarter, we're hoping again to obtain that approval. I think there are maybe 6 other states and I have them down in the notes, and I can look at the end that are included in the first bundle. So with that being said, they're really kind of going through the application and through that more standardized process to ensure that we meet the requirements for this expedited path. So that's again why it was important that we really, again, if we wanted to obtain the expedited approval and be eligible for that, to stay really in the guardrails of that of the letter and guidance. So states that don't meet the expedited path, or they can opt out, they again would go through the regular review process, and that's going to be later in 2025. So with the amount and volume, we can see again why we really stress the importance of we know there are many needs, but we do want to go ahead and be able to seek approval and build as we go. So once we get approval, we can amend and move forward. But we really, again, this again just kind of outlines the complexity of if we don't fit into the expedited approach, what the time frame might be for a later approval. So next steps, again, We are doing obviously everything that we need to do and intend to do to comply with the expedited approval process. And so CMS has asked us to complete some documents and information. Where our teams are working through that, and we do intend to return those as requested by the end of this week. And then CMS will review those, come back to the state if there's any questions, and then they will begin to create the standard terms and conditions, so our SDCs. And their plan is to get those to states by the end of June, early June, and allow the states to review those if there are any concerns, and then get those back to CMS in order to meet the end of June approval date. Again, we talked about 14 work streams. These are to kick off hopefully end of May, and you'll hear from us about those. And so also wanted to make sure that some of you are aware, but we also have a pending application. NASHB and HARP released an opportunity, the State Reentry Learning Collaborative. When you get the slides, it'll this is a link, and you can, if you want to read more about it, obviously all the details you can. We submitted our application in April. We're hoping to hear back next week if we've been selected. So 5 states that have been either approved or have pending reentry applications are eligible to participate. It is an 18-month collaborative. So with the collaborative, we have an opportunity with the other states to have peer-to-peer calls, which would be very beneficial, and discuss, how are they implementing? What are their concerns? What's working for them? Again, I think that would be a great opportunity. And then we can also receive technical assistance through the Learning Collaborative. But really, we feel like after looking at the requirements, that the Learning Collaborative is really going to fit in what our framework already is in terms of our core project team, our work streams. We're already developing our implementation, design, and plan. And so the Learning Collaborative will just, I think, again, be able to supplement that in terms of if we have any concerns or things, we'll have technical assistance that we can, be able to leverage. But again, really feel like the Learning Collaborative is really what we've discussed on these calls in terms of our plan in design and implementation.
And what are those 2 groups? Who are they?
The National Association of State Health Plans.
Okay.
Somebody else might have to help me up. And then HARP is sorry. Let me look it up here, Steve. Yeah, I'll look it up. When we get to the end, I'll look it up. I should have put it in there. When I put the link, I meant to put that.
I thought HARP was just a wannabe carp. It's a joke.
No, it's honestly, we'll have to. It was a CMS, I think, initiative. And so again, this is this is also a CMS initiative that they've asked these agencies to oversee the Learning Collaborative. Okay, so implementation roadmap. I know this is a lot of information, and some of you probably might get tired of hearing it. So this is, we're kind of, and I say this, right? So typically we're in this CMS negotiation phase. Because of this expedited approval process and approach, again, there is, I think, some room for negotiation, but at the same time, again, it is a kind of a standard approval approach, right? So there is a kind of a less negotiation, if you will, typically. And so if there's really things outside of, the guidance that states want to request, you can absolutely do that. You may fit in another bucket, and the negotiations may take longer, if that makes sense. So that's why I say again, the typical CMS negotiations. We again hoping in the next a bit for the waiver approval. So what happens once we, let's say, hopefully get the waiver approval before July 1st? The states will, I think, have 180 days to submit. It's a little bit longer for the reentry process because there are additional components. 180 days to submit our implementation plan to CMS. And so all of the work that we talked about through the advisory work group, work stream, and core team, that's what we're doing, right? Developing what is that implementation plan. And so we'll have 180 days to complete that. So that would be required to be submitted to CMS by the end of 2024, essentially, right? So if we obviously, the goal would be to, to not need all of that time, but that's what would be permitted. And then CMS would review the implementation plan in that time period. I think they're giving themselves 180 days under the expedited approach. I'll have to go back and look at the guidance to be sure, but again, it's in their hands in terms of approval from the implementation plan. So the states could not go live and implement until CMS approves the implementation plan. So that's kind of the next steps in terms of that. In addition, the states also have to submit monitoring protocols in our evaluation designs and a reinvestment plan, which is outside of the implementation plan. Historically, I think, again, through other waivers, CMS the states have been able to implement without monitoring protocols and so forth being approved yet. And so that hasn't always been, a must-have before implementation. But again, you can also see prior, so we get approval for the implementation plan, and then we have to undergo provider our readiness assessments, our system changes, all of that before go live. So just wanted to be transparent about what's to come after that.
So it could be a year implementation and approval process. Maybe.
Correct.
180. Okay.
Yeah. And so again, that is another factor in, right, wanting to try to obtain a timely approval, because even once you get the timely approval, the other approval components are still, can be a lengthy process. So I just want to mention this because you may start to hear more about this, and we'll say that there is definitely more to come. But this doesn't fall into the reentry plan. But if you are familiar with the Consolidations Appropriations Act, CAA, there are requirements that state Medicaid agencies must meet under the act. And there, I think, again, there's information that's forthcoming to states, so we don't have a lot of information. And Steve, we might talk about this in, the next TAC or so. Although this doesn't fall under the 1115, there's going to be some overlapping with the 1115 and things that we'll have to work with CMS on. To identify what that means. So as a part of the Consolidated Appropriations Act of 2023, again, Congress included, there's a section 5121, and it is to address Medicaid and CHIP requirements for certain Medicaid and CHIP beneficiaries that are incarcerated. And so this is for the youth, our youth. And so section 5121 is mandatory for state Medicaid agencies, and the provisions do take effect on January 1st, 2025. So some of the things that we learn about the state's requirements to meet under CAA may impact our timeline for reentry, because there's going to be some overlapping components. So there are some things that we were planning to do through reentry and for our youth that we may have to have in place sooner. And so again, there's lots to still be determined. As you can see, we all states are asking for it, but we have been told that we are tentatively supposed to really be getting guidance in. They said spring of 2024. So we think again this month, sometime this month. So until we really, this is just this overview of what what states know to date. And again, there's still a lot of information to come, and we're going to have some conversations with our CMS 1115 folks about this as well. So again, I just wanted, you'll probably will start to hear more, and you'll probably have many of the same questions that we have. So section 5121. For the purpose of section 5121, an eligible juvenile means that it is a Medicaid eligible individual who is under 21 years of age. So that age is different, if you will, than what we in Medicaid typically would define a youth. And again, in the reentry waiver, the youth who are typically placed in our detention centers that would be eligible for services, again, usually would not go up to 21. So there is, again, some things that have to be worked out and discussed, but that has been made clear to states. It is an eligible individual who is under 21 years of age, or again, for those that are 18 and 26 that are former foster care, that fall into that category.
That would
Sorry.
impact
Let me
some
go back.
folks who are 19, 20, 21 who are at a correction facility. So that now has to be tracked to cover, okay, right?
So there, yes, yes.
Commissioner Porter understands that, I think.
I do.
Yeah. It's yeah. We're anyhow. It's
Yeah.
That's all I know, right? It just is just a little
Right.
speechless right at the moment. I think we all are until we get
Yep.
some guidance. So yes, absolutely. So there are going to be some gaps in, the CAA requirements and the reentry demonstration ask. And so again, it was the guidance just was not available to states at the time that we submitted. So, but we will work through it as we always do, right? So we'll get there. So under section 5121, state Medicaid and CHIP programs are required to have a plan in place. And so that's what's really to be determined is what does a plan in place mean by January 1st of 2025. And so that's what we're, I think, really anticipating in the next few weeks to hear. So 30 days prior to release, and they also say, or, within a week, to your best of knowledge, right? But at least 30 days prior to release. Certain screenings and diagnostic services in accordance to EPSDT requirements for Medicaid or the approved CHIP state plan. And so this will also include behavioral health screenings or diagnostic services to those eligible juveniles, which again is anyone under 21 years of age who is post-adjudicated in public institutions. And then targeted case management services for Medicaid in the 30 days prior to release and for 30 days following release. And so what we're really, again, waiting to hear in guidance through the reentry demonstration, we had requested 60 days. And so what does that mean? We were hoping to be able to meet CAA requirements through the reentry, but we are still going to have to submit some state plans according to what we've heard thus far to meet those requirements. And again, some of the services that we were planning would be that the case management through the managed care organizations up to 12 months. And so again, there's some things under the reentry waiver that we ask it was more than just the minimal requirements under section 512. So just to be determined, I just again put this out here because you're probably going to hear much more of this. And so while it doesn't fall under the reentry demonstration, it is going to have some impacts on the demonstration and some overlaps. So, oops. Okay, so I'll pause. Like I always said, I know this is a lot of information to throw at you all, but we just want to make sure that you're again aware of the requirements and the asks, and we're very thankful. I know we all are for the opportunity. We again know that there are more asks that we would like to include, and again over time would love to do that. We've talked about, and we will through some of the work streams in our work groups. Hopefully there's some avenues that we can still start to address some of those known needs, and also be able to use some braided and blended funding to do that until Medicaid again gets the waiver off the ground, and again amend and grow our benefit package and our coverage settings over time. So any questions?
Hey, Angela, I can't remember. Do you remember? I know California, but I can't remember who the other states are that have already been approved. Do you remember off the top of your head? I can Google it and find it later if not.
Good question. I did, but on the spot, is it, I think Montana maybe was one of.
I can look and find out. I just didn't know if you remember.
We'll Google it. No, because you're correct.
Yeah.
In Washington, I think Washington was one of those. Let me, Washington, it was one of the end states. I think Montana.
I know. It's okay. It's okay. I don't want to take up time for the group. So
R.C. Timmerman just reported Montana and Washington.
Montana, Washington, California. And then I think maybe Mass was the other one. There was one that just within the last couple of weeks.
Okay.
And so here is I did try to put that in the notes here. So the first bundle, so the other states that are included with Kentucky, Oregon, Utah, Vermont, Illinois, New Hampshire, and New Mexico. Those are the other states included in this first approval bundle.
Thank you.
You're welcome.
Other questions? That was a lot of information. It's kind of exciting though. I mean, we've been meeting for a couple of years, and now we have something tangible before us. So, and we'll all get those PowerPoints, you know, so they'll be available for folks. They can look at them and maybe generate more questions. But Angela, it's great work, you and your team. We appreciate that. Leslie, you as well. And you spoke nonstop for an hour. So take a breath. So normally we're done by 10. We can keep going, but if folks have things they need to do, it's okay by me if we pick up the MCO reports in 2 months. What's the will of the group?
And I'm gonna have to sign off, and if there's anything we need to vote on, I'll stay though for a minute or two.
Yeah, let's do the minutes real quick. I think that's the real deal, and then we'll pick up where we left off in 2 months. So we initially had a moment, cameras need to be on for voting, right?
Yes,
There you
please.
go. So let's get the minutes done. Do I have a motion to approve?
So moved.
Dan Ingram, do I have a second?
Second, Brandon.
Brandon, all in favor, signal saying aye.
Aye.
Approved. And MCO partners, I apologize that you were on, but you got to hear good information, I think, so it's worthwhile. And
Yeah,
we'll
we
see.
greatly, I just want to say, Stuart, we greatly appreciate the presentation by Angela today, by the way.
Yeah, it was really good.
Yep. Well done, Angela.
So, all right, we'll see everyone July 11th.
Have a great rest of the day.
You
Thank
too.
you all.
Take
Have
care.
You have a
Bye-bye.
good one.
Nice work, Angela.